Hello, good morning, Lisa. How are you today?
I'm great, Dr. Kiltz. How are you?
Spectacular. A beautiful day.
It really is. It's a great summer day.
It is. And I always say I'm breathing, and I go like this and check a pulse, and I say, okay, it's a beautiful day.
And it's easy.
It's all easy. But you got to say it's all easy because there's lots of challenges in life. But they're all gifts for us every day to grow and learn. And I say God creates it all. What an amazing gift. So what are we talking about today?
Well, we recently started a Facebook pregnancy support group for all of our clients in early pregnancy and maybe facing the challenges of pregnancy after losses. And so I was wondering, what kind of support do we offer clients on the clinical side for their early pregnancies?
Well, the support is so critical and important for all of us in just our daily lives, and we love just someone saying, it's a beautiful day, and how are you, and I love you.
Yes.
That's great support. Listening, great support. And telling your story is great support. But along with that, some of the causes of early miscarriage may be immunologic factors, maybe hormonal factors, luteal phase defects, low progesterone levels, may be related to chromosomal factors, which we may not be able to change very much for that pregnancy. But some of the things that I think are important, progesterone, whether you're taking a vaginal progesterone or an intramuscular progesterone, a little added progesterone is a good support.
Great.
I do also recommend baby aspirin for women who have experienced early losses or infertility, because there's an immunologic side that reducing the thrombosis of the small vessels in the placenta may help support the pregnancy.
Great.
For some women who have lupus anticoagulant or unknown causes, we may also add things like Lovenox, or heparin, which is a blood thinner, which, again, you need to talk to your doctor and get a little bit more information whether or not it's valuable, and make sure you don't have any risk factors that you shouldn't be on it. And if you have bleeding early in pregnancy, we often stop it, but that may also be valuable in this. And we're talking about some of the pharmacological things that we use here. Another one that we often use is intralipids, which I call it the milkshake, which also may help reduce the inflammation, immunologic response, and maybe natural killer cells, which may be measured, or you may be just treating empirically. And often it's given just before pregnancy, but it may be given every 4 weeks for the first trimester, which may be helpful also. Certainly recommend self-touch, massage, Maya massage, acupuncture. I'm a big believer in daily meditation and prayer, and just working to create the dream of calmness. Very valuable in our lives, because when you can do that, you actually reduce cortisol and epinephrine, you raise oxytocin levels. And so just coming into a group and sharing the story, by the way, does the same thing. And it actually increases your chances of carrying your pregnancy to term. So things that I highly recommend. That's a little bit of what I call the blanket approach. One other pharmacologic treatment that we often use is HCG shots. So these are little booster shots that have been shown to also reduce the risk of miscarriage. It's given every 2 to 3 days as a subcutaneous shot. Talk to your clinician, talk to us. We'll be glad to help in one way or another. But that support every day is so important for us as human beings.
Yes. Well, thank you so much for your inspiring words. We have a great meeting next week in Syracuse. We're going to hear from past clients who have conceived with us with IUI, donor eggs, and IVF. So again, sharing those stories and getting those inspirational stories from others who've been there and come through the other side.
We do learn and grow from these stories, and I know this is a lot we've talked about in a short amount of time. So it's important to ask the question, what else is out there? And I'm always here to learn more, because I know there's something that I might not have mentioned or I just don't even know about yet. So,
Well, thank you very much.
Thanks, Lisa, and thank you guys. God bless. Have a great day.